Well, I used to say I feel like dying because I get so stressed out. It seemed like it would be easier just to go try to just quit and just try to drop dead. It's been a rough life growing up. I was physically abused as a child, just not sexually, just beat all the time, and verbally abused as well. She beat me pretty severely with a broomstick, and she was pregnant at the time, and my mom gave birth to a stillborn baby, and she told me it was my fault. And the last thing my dad told me before he died, I hate you. And then like 2 days later, he was dead. I've seen many physicians over the years, and my current physician, he asked me to trust him. He said, I need you to trust me because I'm going to trust you. And we have to work hand in hand to try and figure out what's going on with you emotionally as well as physically, because I was pretty depressed.
Dr. Glenn Madrid of Grand Junction, Colorado, is using a new care model that allowed him to hire case coordinators and use better technology so that patients have access to him 24/7. I don't know when that lets him sleep, but his patients are sleeping better.
That's really the process that we need to spread, is being proud of the things that we've done here in Grand Junction and really letting the rest of the state and really the rest of the country understand what we're doing and the successes that we've had.
Normally in the United States, we think that high cost goes along with high quality, but the truth is, in the United States, the highest quality and lowest cost is in the same community, and that's in Grand Junction. And I wanted to find out what their secret sauce is. So the very first thing I did after being elected was to fly out to Grand Junction and spend 3 days going to offices, to talk to insurance, to talk to employers out there. The secret of Grand Junction isn't really a secret. It's about basing the healthcare system for that valley around family medicine and primary care. What's right for my patient? What's right for my community? How can we help educate doctors to do the right care? How can we make certain that everyone in Grand Junction is part of that system? You end up with higher quality care and lower costs. That's the Grand Junction secret.
I think the collaboration in Grand Junction is probably what sets us apart from other communities. And that goes way back, as you've heard, back into the 1970s from folks that, long before I was ever here.
This was the most compatible medical group that I had ever met, because I had been to other communities and we didn't have the togetherness that Grand Junction had. And I think that helped make things what they were here.
It's that warm handoff that we do in this community so much better than we do others.
One had the sense of really trying to get the job done for the patient. One had the sense of an absence of greed, that that we were here to do something important and that we worked together to get it done.
Teamwork is really the key. That's really the future of primary care.
I think we work alongside people who we know in different ways too. So I think it creates a really friendly atmosphere. People on a first name basis. It's pretty easy to pick up the phone and call someone and say, I have this patient here, this is what's going on. Should I send him to your office, or would you recommend I get certain studies first? What do you think? And so I think that's a real benefit. There's very few people who are just an anonymous voice on the other end of the phone. Like, you actually know people and you actually get to know who they are outside of work a little bit. And so I do think there is a lot of collaboration.
Since those early days, I've learned if I have a team member, I can be more available, maybe not always, but more available. I can know more than one single person could ever know. And I can always care in certain dimensions when I'm spent another person from another angle can come in and not only care more, but know more, do more in a slightly different complementary way. Therefore, I don't carry the whole burden. I'm not squished with that responsibility.
I used to tell my patients when Dan Reeves coached the Broncos, remember that? I said, I'm like Dan Reeves. I said, I can't kick the ball better, and I can't pass it better, and I can't block better than anybody else, but I know somebody that can. And I said, when we need those, we'll get you those.
I think that helps to know you have real friendly relations with the doctors you're working with.
And in regards to the specialists, I think the relationship has been one of respect and definitely one of collaboration.
I think that there's a real core of good communication between the specialists and the primary care docs. And I think that communication leads to trust between one another, and it's that trust that drives the relationship.
Grand Junction has always been a kind of a unique care situation in that the specialists have gotten along very well. There's not been any problems with people trying to do things that they shouldn't be doing. We've not had a lot of malpractice in this community, and there's a lot of give and take, and there's a lot of peer review looking over each other's shoulders, which has made a huge difference.
The family physicians in Grand Junction have always been very gracious in allowing us to see their patients and to help in their care.
A lot of the specialists teach their residents, and I think they do that because they recognize the importance of strong family physicians.
Clearly there's a very good cooperative spirit and communication amongst the physicians in Grand Junction. That's what makes, I think, our medical staff as whole as it is.
It's really a product of a lot of cooperation early on to make sure that we didn't try to have turf wars, and we prevented those for the most part.
One of the things I noticed right away is that when I could get something good to happen in a clinic, it was always because there was a good cooperation between the physician leader and the administrative leader, and they actually could run good meetings. And when I couldn't get something going, they either were like ships passing in the night, the administrator and the doctor, or the meetings were all disorganized and unproductive.
You know, the family practice docs seem to work so well together. And I think the more junior people say, okay, that is a good way to work it out, and it makes a lot of sense to, we share this, and we want to take care of the kids, we want to take care of the pregnant women, we want to take care of the babies, even though they don't have insurance. They're part of our community, and we want to do the best for our community.
And fortunately, we had leadership through the years here in Grand Junction in Mesa County that realized that. And the importance of the collaboration.
Overall, I think the amount of collaboration and respect that's present here in Grand Junction is unique. You're always glad to pick somebody's brain, so to speak, and say, what do you think about such and such for so-and-so? And a lot of discussion went on. I talk with my partners every day. There isn't a day that goes by that I don't take them in an exam room and introduce them to a patient of mine and ask them, could you look at this person's ear and give me their opinion? Or we'll go talk about various different treatment options, and I'll say, this is what I was thinking, but what do you think about this option? That happens multiple times every day.
There is a good conversation, there always has been, between doctors.
Here in Grand Junction, 2 in the morning, I've got a question that I need to ask a thoracic surgeon. You get on the phone, and nobody likes to be awakened at 2 in the morning, but they're always, absolutely, always cordial. And if you need me to come in, Joel, I'll come in right away, and we'll get this thing taken care of. It's been a wonderful place to practice medicine. And
I think what's different about this community is there's been a more cohesive, collaborative vision to help us reach some of the goals that you need to reach the broader goal of excellent health care and taking care of the population.
Do you want to double down on collaboration, on how you make it work, not just for your business, but for the community that you serve? Or do you want to sort of hunker down in terms of how do I protect my silo and make sure I get mine? We've always chosen the path of collaboration. I hope we will continue to do so in the future. In the first part of this century, in 2003 I believe it was, we said, okay, you want to argue about data, let's capture the data. And we created quality health networks. By we, I mean Rocky and the physicians agreed, and then the hospitals contributed to fund an electronic data transmission center so that all of the data was kept, all the medical records were kept in a very IT savvy way.
It is a repository for medical records from a lot of different areas to be put into. So that if I'm seeing a patient who may have been seen at another facility here in town or in the surrounding area, I can have access to the notes from the providers who saw them, as well as imaging studies like X-ray reports, CT reports, lab reports, and so I can have really quick access to a lot of information about the medical care that patients already received. And so it's a really wonderful resource for us here in this community.
I think coming from Southern California, where it's so big and there's so many different medical organizations, that we would have somebody come into our ER and they'd say, well, I just had an ultrasound down at Beaver. And we're like, but we can't get those ultrasound results. And you're here with right upper quadrant pain, so I have to repeat the ultrasound. And in Grand Junction, I never have any issues. If I need to do something and somebody's already done it at community hospital or at primary care physicians, it's really easy for me to get that through QHN.
We have to be able to be transparent. That's another lesson from Grand Junction, is that when you can share data and help patients and doctors together make decisions with understanding the outcomes and understanding the costs, they make the right care decisions.
I think it's really just a nice way for us to have information on that patient when they're in the room with us, rather than having to call them back later once we've tracked down their records, etc. So it's a way to really know what's going on with them as quickly as possible.
What you're trying to do is to have some sort of a way to measure quality. And if you can measure quality, then you can also set up ways of changing it.
And all of a sudden, we could stop arguing about whether the data is correct or incorrect. We could talk about what you really ought to be talking about, which is what's the best way to practice medicine for this particular patient.
You get down to metrics. You got to be able to say, all right, what is the data? Can you measure it? Because without the data, nobody really knows how you're doing.
Many of us make the assumption that we're doing a great job. We all hope and strive to be. And many times we are, but if there are some things where we aren't, again, that allows us with those metrics to maybe focus on some of those things and again, help improve the overall quality in the process.
Let's take electronic health information and help physicians utilize it in the most effective way and spread it through a larger area. So we created that. That led to the practice transformation efforts to help physicians practice medicine better based on information, on data, on the ability to measure quality.
You know, before you analyze data, you got to collect it. And if you only have a little bits of data, you can't really analyze it all that well. So being able to have one place that's helping coordinate the collection of data, and then to start down that pathway of analyzing it, is really very beneficial.
Again, we have the luxury of having such great coordination, and that's absolutely an integral part of our success.
And what we do is needs to be driven by the data and the quality metrics that will be in place.
Anytime you're talking healthcare now, I think it's important to go back and be patient-centered about it. So, the quality improvement, it means, enhancing the patient's experience, better healthcare. But also, I think when we talk quality, we also have to address the cost. So that, it just sort of got to the triple aim there. And I like to intertwine quality and value, because without addressing cost, our quality is going to suffer. Because if we just thought about quality and didn't think about cost, things would get so expensive that we leave off a huge part of the population without access to health care.
I think we have a big advantage we didn't have in the past 20 years, which are evolvingly different payment models.
So the Comprehensive Primary Care Initiative, so this is a 4-year pilot, if you will, close to 500 practices in the United States, 75 in Colorado, and 4 here in Grand Junction. We were lucky enough to be one of those 4. And so it's really part of innovation, paying for value rather than volume.
And the world around us is saying, we don't want to pay for volume anymore. They're done paying for volume. Government, state, federal, local has said, we can't keep doing this. This is costing us way too much money. And the private world, companies, insurance companies are also saying, wait a second, we have to respond to all these forces as well. So we're hearing that, whether that's the Centers for Medicare and Medicaid Services this last February saying, in the next few years, we're shifting you all from volume to value as far as how we're going to pay you. To actually, one of the only bipartisan things that has come out of this Congress in the last 4 to 6 years was the SGR fix. Both sides of the aisle say, we're going to pay hospitals, doctors differently because we get it. Volume isn't getting us where we want to go. We have to pay for value.
If we take the fact that we can now measure quality, not just cost, but quality, and we build a model so that physicians and hospitals are reimbursed on the basis of the quality of care they give, not just how many people they see in a given day, then you're going to be able to build a more efficient system. It's going to lower cost, it's going to improve quality, which means it's a better value proposition.
We know now that insurance companies and the United States government is trying to move healthcare in a way that is similar to Grand Junction, where instead of paying for doing more widgets, doing more stuff, paying for volume, that you pay for actual improved outcomes.
And so what fee-for-service tells the providers and the hospitals to do is do more. That's a flaw. Value-based care says, let's pay for the high quality of care. What's appropriate care? Okay? And that's why the data is so important, because you have to have the data to back that up. So you move away from incentivizing doing more and more and more, which has led to a problem of delivering health care to the poor, to a value-based system where you're saying, okay, we're going to pay you guys, the health system, hospitals, doctors, whomever, on the results that you show us.
My whole career, it drove me crazy that we couldn't change anything. And I see that changing.
We have a pod-based system in our clinic. So, for example, I'm on the Blue Mesa pod, and every month we meet and we do PDSA cycles, plan, do, study, act, and we try to tackle a problem that we think is important and relevant to our patients, and try to look at the issue and look at why things are happening the way they are right now, figure out how we can do it a little bit differently, and then really monitor those results.
We all bring different things to the party. We all are trained to see different things in different ways at levels of expertise. And the big task is to combine all those views, all those observers, all those views, to get them to add up for the patient so they get more than they could have gotten from any one of us alone.
We each have our pods, we call them, our teams. And so a physician, a mid-level, mostly PAs, but now nurse practitioners, along with our medical assistants. And if we use that as the team, together now with these case coordinators and the pharmacists and the behavioral health specialists, we can do a better job taking care of not just the people who come into our office, but taking care of those patients that are part of our patient family.
Other components of the team huddle, we have a behavioral health specialist that will try to be there once a week. My medical assistant will be there, a triage nurse. I mean, we try to bring who we can that can help with those patients.
Just having a team surrounding one patient in an exam room has been pretty emotional for them. Rewarding, but still emotional. And I think just this real sense that, wow, there's a group of people that really care about me. And we can be pretty good about utilizing time. You know, sometimes it's appropriate for the physician to move on to the next patient, and I can stay, and then we can loop back. We talk weekly with each physician. We have a huddle, you know, where we talk about, you know, the highest need patients that between the care coordinators, the nursing support, the physicians, and the behavioral health provider, talking about how can we intervene in such a way that this patient is going to do better.
The most important thing to know is when you need a team. That is, the work in front of you is going to take more than I have by myself.
That's what has made Grand Junction special, because you guys were able to align family medicine's values to work together as a team, to be able to make certain that every young child was able to see the same family doctor over time. You can get the triple aim of medicine: higher quality, lower costs, and most importantly, healthier people.
Well, the advantage I have, I've known them for years, most of them, and I know their health problems. I know the medications they take and their idiosyncrasies and all of that stuff, and I know the family, and I know the family situation, and it just helps to have somebody know you and that's been taking care of you all the time.
No matter what setting you're in, Bronx, New York, Melford, Grand Junction, we need to practice to the full comprehensive level that we can practice.
Every interaction ought to benefit the patient.
Patient-centered medical home is a concept that actually started several years ago with the American Academy of Pediatrics, actually. And it was really based on the concept that every citizen should have a place that they identify as their medical home, where they can turn to for their medical needs.
I think comprehensive care from a family practice standpoint means seeing the patient wherever they are. If it's in the office, or in the nursing home, or the hospital, or in their own home.
The comprehensive care model, I think I've learned a lot about in residency, because our residency was a patient-centered medical home. And during residency, you see all the benefits of that, because we work with a lot of complex patients. And everybody has not just physical health needs, but also mental health needs. And so I think a comprehensive care model allows us to better address the whole person, and better address and kind of work within the physical constraints of, you know, what we call the social determinants of health, because I think we're paying more attention to those and realizing how much more those aspects impact health. And the comprehensive care model allows us to better address those things. And I think that allows us to provide better patient care, more effective, cost-effective care.
Modern day practice with the old fee-for-service system, there's no way to pay for those things. And so CPCI does allow you the funding mechanism to put those things into play. Things that have been proven to improve quality in healthcare: embedded behavioralists, care coordination, team-based care that allows you to really focus on those folks that have the highest needs in your practice, that top 10%, or whatever that percentage is in a practice, that really requires ongoing monitoring, coordination of care, meeting the needs that go well beyond what meds they're on, to help them, you know, reduce their rate of use of the ER, decrease their chances of hospitalization, and try to help themselves stay healthy.
Grand Junction has been known by us and admired for a long time for the way it has collaborated and done primary care, including early work with behavioral health integration.
So integrated behavioral health is a wonderful concept of essentially having that warm handoff, if you will. So we know a huge part of our healthcare dollars are spent, at least in part, by mental health issues. And certainly if we can focus not just on a person's physical health, but on their mental health, their overall quality is better, and of course we can see our costs go down. One of the problems, though, is if you have someone who, say, has an anxiety problem or a depression problem, some psychiatric issue, especially if it's not urgent, well, in the past it would simply be a referral to your behavioral health specialist of your choosing, making the assumption, making the hope that the patient would make the appointment. And many times, a person would never follow up with a behavioral health specialist.
Many people don't make it to mental health clinics, even if they're referred to that. As important and critical as mental health clinics are, a lot of people who would come to primary care wouldn't necessarily go.
What surprised me the most is how well patients responded, that we had symptoms decreasing more quickly than we would have in traditional outpatient. Plus we picked up patients that would have never came into traditional outpatient therapy. So it's that team-based approach. It was an open access, and most importantly, it's access when the patient needs it. That's why it works, I think, so well.
We can bring a behavioral health specialist in to spend that quality time with them. What that helps is reduce, a second visit, maybe reduce an ER visit for anxiety or worsening depression. Hopefully get them in on the mental health system before it becomes a crisis.
In this setting with behavioral health specialists within our practice walls, there's the warm handoff. I can literally have that behavioral health specialist come in the day that patient is in and initiate some counseling and maybe some follow-up. And that might be following up in that behavioral health specialist's office down the road, or maybe simply in conjunction with a visit with myself a week or 2 or 3 down the road, but essentially guaranteeing that that person has had some contact with a behavioral health specialist.
What happened with a patient is that they'd be often faced with a forced choice. Now, I got my whole pot of problems. I'm stressed out, I've got some diabetes, I have this and I have that, but when I go in, I'm going to have a forced choice between talking about physical complaints or mental health complaints, or have 2 kinds of providers, and actually have 2 kinds of benefits and 2 kinds of co-pays and 2 parking lots to go to. And so often it was fragmented and difficult. So if they are in their primary care visit, their family medicine visit, and they start talking about things that have anxiety and depression, or being stressed out, or having real issues that make it hard to pay attention to your diabetes, or that are making life hard, there's no reason not to be able to work with that right there in the primary care setting. The doctor can say, you have a lot going on. The good news is you have these manageable health conditions, but I can see you're really stressed with that. You have those issues and concerns, and those are really important. And my colleague who works right here works with me all the time. He's somebody always working with me and my patients with those issues. And in fact, would you like to meet him right now? Then come and you meet the person and set up the thing. It's not like here's an 800 number to go to, or another place across town that makes the patient think, well, I'm not so sure, And it's not like I really have a mental illness. I sure could use some help and coaching, but it's not like I have mental illness. So, it just lowers the barriers to get in.
We don't know what is unleashed if we can genuinely, this isn't slavering over people and painting them with butter, none of that. This has to be genuine. And if I can find that in the middle of these impossible things, including non-responding illness treatments, I can be there with them in a way they can grab hold. It's less relevant what I'm grabbing than it is what they do.
You have to sit across from somebody and you have to hear their story, and you have to see their family to know really what the psychological things are that are going on.
They come as a whole person. This is the lingo that people use now. And in the past, the tradition was to try to separate out, well, here's the physical and here's the mental.
I think it's that we finally have came to terms with the brain and the mind and the body are all connected, and we should probably treat it in a holistic or comprehensive way that we didn't do when behavioral health was one silo and medicine was another. It just wasn't as effective, but it was the only way it could be done for a long time.
But I think if you know the whole person, you can tailor their therapy better. And I think it just makes it more fun to know the person rather than just know the chart.
Relationships are important. And one of the things I tell the medical students that I mentor for and teach is that listen to your patients. They'll tell you their diagnosis, but you got to listen carefully. And if you listen very carefully, you'll learn from them. You'll learn things about life.
Finding someone who is willing to listen to you and go on what you're telling them and try to figure out a way to help you. Most people would say, you're too complicated, go away. You know, I just can't, or I can't handle you. To my current physicians, like once again, thank you. They've taken the time and the effort. And like I said, that is totally new for me. And I'm very appreciative of it. Literally the first time in my life, in all my medical experiences, that I feel connected with my physician. It's a neat feeling to know that there is somebody that I can trust with my health. And as far as Grand Junction's medical facilities and everything are, like I said, I'd be lost, I'd be dead without them.
I tingle now talking about it. The potency of that experience of a person grabbing a hold of their own life, changing it, sometimes for generations, is one of life's greatest experiences. I mean, it's really good.
The most fun I've had is when you meet somebody in the office and you see them out in the street and they're your friends. And if they notice you and you shake hands, you talk to them, you don't have to talk about medicine. That's the best part of the whole office practice of medicine. You meet them on the street and they're still friends and you know that you've done a good job.
And it's such a wonderful profession in the sense that it's not, it doesn't stop. It just continues to grow and get better and better and better.
It's a very good community. People are very open to one another.
I think your patients are really family. You know, you're losing some of your family when there's a death. It's not just another patient that dies. You know, it really is part of the family. It's not just another patient that gets ill or falls and breaks their hip. You know, it really is part of your family, and I think, but it's rewarding. Our patients rely on us. They trust us. And I think being able to be so intimately involved in another person's life and to help direct their care and hopefully help with the quality of their life from a medical standpoint is just an amazing thing. It's a privilege, no question.
When I first came here, I was like, I am so amazed at the quality of medical professions that are in Grand Junction. There are amazing doctors, and this isn't Hollywood. They're not getting paid millions of dollars to be here. They're here because they love the quality of life and they love the way medicine is practiced in this city. And so I think that it's just a lot of different building blocks have made that special, but I think that the fact that we can easily get medical information keeps costs low. The fact that we have wonderful relationships with the different specialists allows primary care doctors to manage things without sending people to specialists inappropriately. And I think just the genuine regard that physicians in all the specialties have for one another really sets Grand Junction apart.
Then the Dartmouth Atlas study came out, and whoa, we had no idea that we were so exceptional. We assumed everybody was working on this, and it turns out hardly anybody was working on this.
It's not about ego, it's not about prestige, it's not even about money. You got to align the financial incentives. It's about the patient. Who can do the most effective job for this patient? We happen to live in a community where a lot of people have embraced that kind of concept, and as a result, we have a health system that embraces it.
We're on tap, not on top. That's the future, not only in mental health and integration, but overall in healthcare.
If you work together, if you collaborate, good things can happen. And a lot of that motivation comes out of, well, what was done here before? What did we do here before in Mesa County? And we can do that again. What is the next chapter in Mesa County? And a want and a desire to write that next chapter. One that's value-based.
You can export this approach anywhere where a community wants to solve the problem.
The day-to-day process of just being a healthcare provider, for one, is pretty overwhelming and pretty exhausting. And at the end of the day, you don't have a lot of energy for bigger picture thinking, and you really need a common institution or a common ground to meet with other people who want to think about these, to give you sort of the energy to do it and to feel like you can do it.
Leadership. I mean, without the leadership, you can't get there. You have to have a few people willing to, take it on the chin every once in a while and lead. If you can identify some leaders, and if you have a willingness to address a problem, then you've got the kindling to start a fire of reform. You've just got a few leaders, you can sit around a table with a few organizations, and you can start something. There was nothing magic about what happened here 40 years ago. It was brought on by real things, leadership, vision, and a willingness to change. That's nothing magic about that. It's just people willing to put the time and effort into it and show leadership and get it done.